SEIU Healthcare, as you know, represent workers in 3 different countries, and we share common challenges and common dreams. Everyone in this hall and everyone in our convention is an organizer. Nothing will deter us from the mission to build this union. Not hostile employer, not anti-labor judges and legislation, not right-wing politicians, and as the old civil rights anthem had it, we ain't gonna let nobody turn us around.
Es de cardinal importancia romper el cerco del aislamiento entre trabajadores que imponen los patronos para diluir nuestras fuerzas y sacar provecho de la fragmentación de nuestras luchas. Hoy estamos dando un paso afirmativo en esa dirección.
We know how to take on companies like Tenet. We know what it takes. We know it takes all of us, coast to coast, united together.
Our members and staff are proof that we can win big. It doesn't always have to be adversarial. We're fired up. Are you fired up today?
When we stand together and stand up for our residents, anything is possible.
Together, we are a powerful voice for our patients and our profession. We stand united, and we are making a difference.
Very proud to be a part of a national union, and we understand the importance of using our strength in California to help organize nurses and hospital workers throughout the United States.
We are one union, and this is our fight. Thank you.
In 2001, SEIU decided to organize 42,000 home care workers in Michigan. 6 years later, we achieved our first contract. There is no way that Michigan could afford to pull this off alone. Every person in this room had a hand in our victory in Michigan. Together, we have changed thousands of lives in Michigan. You passed on your dream. Thank you.
Our Local 49 did not vote in the majority on various issues that are presented before this division and before the convention. However, we recognize that there are legitimate differences of opinion on these issues, and that fundamentally we need unity to be strong and to be successful. And we believe that the opportunities before us demand that we should find common ground to move forward on the Justice for All program.
We built the biggest, the boldest, the baddest union in the nation. Today we are stronger than we were in 2004. Those numbers, each one of them represent a life and a voice that found itself. It's a voice that now has a new kind of power. There are 9 million other folk out there who do the same work that we do, but don't have the voice that we have. And so we decided we were going to help build the platform that would launch the movement that would unite their strength with ours.
When we stand together and stand up for residents, anything is possible. And I want you to know that that spirit is the spirit we offer the Strategic Unity Plan that local leaders and members and staff have been working on together over the past year for your consideration today. We can't continue to maintain and improve the standards unless we make a national plan to unite all workers in our industry and go to a national table together to change our healthcare system so everybody has access to quality, affordable healthcare. So we think the choice is clear. Do we want to keep on the path and celebrate a few victories? Or do we want to pursue this path where we reach to try and organize 350,000 more healthcare workers in the next 4 years? We want to win a more just society. We want to win justice for all and pass it on.
Are we prepared as a national organization to bring maximum cooperation, maximum unity, maximum coordination, and maximum discipline to how we engage healthcare all across America? We will debate, we will talk, we will figure out a strategy, but when we decide, we all carry out the program. Sisters and brothers, it is about winning. Are you ready to win? I am ready to win. Mr. Chairman, on behalf of the Council of Healthcare Locals, I move for adoption of the Strategic Unity Plan that includes, number one, our goal for increasing our strength by uniting 350,000 more healthcare workers in the next 4 years. Number two, for the creation of a National Hospital Bargaining Council. And number three, for the creation of a National Long-Term Care Bargaining Council to enact our employer relations strategy with nursing homes, employers, agency home care, and other sectors as new breakthroughs become possible. Thank you very much.
A motion has been made. Do we have a second? Okay.
We love this union, and we are proud to be a part of this union. We absolutely agree with the goals and the philosophy that Brother Reagan just laid out, but there's one significant disagreement. These bargaining councils do away with those unity councils that we established 4 years ago.
I'm proud to say, the first time in our history in Canada, we are over 100,000 members strong. And that did not come easy, sisters and brothers. And I'm here on behalf of those 100,000 members to support this motion.
We need to unite as one national, powerful union. Our industries organized nationally. That's what these bargaining councils are about.
Density is not enough. We need to have union contracts, and we have seen in New York the difference in building the union among workers, home care workers. You cannot reach home care workers unless you have a union contract.
I'm a member. There's nothing wrong with members being involved in the process. We should demand this be amended to make sure that we're guaranteed a seat and a say in the process. That's all we're asking for.
If unions don't want to join, or a small worker doesn't want to join, we shouldn't force them to do that. That's their disadvantage. But the member has to be in every step of the way within SEIU.
If you're here as a worker, representative, rank and file, please stand. And yet we say that the members does not have a voice in decision making. But I'm here to prove to you that we are the voice of the members.
Over here is a woman named Bradia Daniels who signed a union card at what was 434B back in 1988, and it took her 11 years to get a union. That local didn't exist. They didn't have a single dollar, and workers from Oregon and New York and Illinois pooled their resources through our union and gave Bradia Daniels and Beatriz Hernandez and Addie Parsons, gave them the right to have a union for the first time. We have to stand up. We have to do the right thing. You know what the right thing is. Now let's do it.
Those in favor of the Strategic Unity Plan, please stand. Those opposed, please stand. The Strategic Unity Plan has been adopted. Thank you.
We are the winds of change, not the politicians. So after this election, let's not be fooled about what we did before the election. It's about what we're going to do after the election. And after this election, let's let SEIU, let's let us lift our voices. Let's let us speak out for justice, for every man, woman, and child. Let's speak out for an America and a Puerto Rico and a Canada where no matter the color of your skin or the language you speak, whether you're gay or straight, man, woman, black or white, there is justice for all. Sui justicia para todos. That's why we're here. That's why we're